Friends, this is Dr. Bharati from AL Arogya Spine and Bone Care Center. Today we are going to see about varicose vein ulcer and varicose vein. We have two types of blood in our body. One is oxygenated blood, one is deoxygenated blood. Arteries will carry the oxygenated blood. Veins will carry the deoxygenated blood. From the heart, oxygenated blood will comes to the other parts through arteries. Through veins from other parts, blood will go to the heart. So when we pour the water from upside to downside, it's very easily it will pour due to the gravity. But we cannot pour the water from down to upside. For pushing the blood, we need a motor. So calf muscles act as a motor for the pumping the blood towards the heart. When these calf muscles get weakened, we get varicose vein. How the calf muscles get weakened? Because we do lack of exercise for the calf muscles. Some people doesn't do exercise at all for the calf muscles, and they stand for a long time. For example, those are working as a security, and those are working in the hotel as a tea masters, and those are working as a teacher, they stand for a long time. So those people get varicose vein. Even in housewife, they stand in a kitchen hours and hours. And for ladies, while they are in pregnant, they get hormonal imbalance, and due to the overweight, they may get varicose vein. So in blood vessels, in venous system, when the bad blood, deoxygenated blood stays and it is not going to the heart to convert into the good blood, oxygenated blood, so it will store for a long time and days. So what will happen in the blood? We all know that we have a hemoglobin. That hemoglobin divided into two things. One is hemosiderin. So the hemosiderin will make the skin as a black. You can see in the patient this area is very black compared to this area. You can see when it is turning into the black color, it means that there is a lot of hemosiderin in the skin. So this is a normal skin, this is a hemosiderin contaminated skin. So next thing, hemoglobin will produce the biliverdin also. Biliverdin will make the skin to produce a itching tendency. When we itch on the skins, that time wound will come, and years together the varicose vein ulcer will not get cured unless you take proper treatment or you take care of your wound care properly. You may see people on the roadside, they will be wearing a stockings and they will be wearing a grip band for the legs, or they may put some bandage in their legs. They will be walking with a bandage. When they remove the bandage, bad smell will come because they are not carrying the wound properly. They will not clean it properly because they may get pain in the wound. So due to that, they are scared to clean the wound. But please make sure that when you have a wound, whether it is a varicose vein ulcer or diabetic ulcer, whatever may be, you must clean the wound properly. Then only it will not spread, and some people will get cellulitis because they don't care the wound properly. So care your wounds and clean properly every day. And food plays a major role in wound healing. So you must take vitamin C as much as you can, like amla, like orange. That will produce a healing process. So in our center, we give a treatment for varicose vein ulcer and as well as for diabetic ulcer. If you have any problem with your varicose and diabetic ulcers, you can come to us. We'll be providing an address in our end of the video. Hi friends, after 3 weeks again we plan to take another video because you need to see dramatic magic happen in her leg, because the wound completely got cured with natural treatment. Just you can see her wound now. See, now you can see the wound is very small. Within 2 days that will also get vanished. Before the wound was this much bigger. Now it is very clear. Even the blackish discoloration also slowly day by day it is changing. So you can see the changes what and all happen in her leg. I'll show you the leg when she came on first day also. We didn't do any surgery or we didn't give much medication for taking internally. With just natural treatment and with good diet, she was very cooperative and she was very punctual, and she eat whatever we prescribe for her good health, because whichever food which makes healing process more, that fruits and that vegetables, that diet we prescribe her, she was following very perfectly. Even a single day she never used to miss any of her diet. She used to clean her wound properly, and every 2 hours she used to clean, because since almost 3 months she was suffering from the wound. So I used to tell her, if you clean your wound properly, that will get cured soon. So she used to clean her wound every 2 hours once. So thanks for watching. I'll meet you in another video. Thank you so much.